New eating disorders in the 11th revision of the International Classification of Diseases, binge eating disorder and avoidant restrictive food intake disorder. (6B82) Binge eating disorder. The addition of binge eating disorder in the ICD-11 is based on extensive research that has emerged during the last 20 years, supporting its validity and clinical utility. Individuals who report episodes of binge eating without inappropriate compensatory behaviours represent the most common group among those who receive ICD-10 diagnoses of other specified or unspecified eating disorder, so that it is expected that the inclusion of binge eating disorder will reduce these diagnoses. Essential, required, features of binge eating disorder. 1. Frequent, recurrent episodes of binge eating, for example, once a week or more over a period of 3 months. Binge eating is defined as a discrete period of time, for example, 2 hours, during which the individual experiences a loss of control over their eating behavior and eats notably more or differently than usual. Loss of control over eating may be described by the individual as feeling like they cannot stop or limit the amount or type of food eaten, having difficulty stopping eating once they have started, or giving up even trying to control their eating because they know they will end up overeating. The binge eating episodes are not regularly accompanied by inappropriate compensatory behaviors aimed at preventing weight gain. The symptoms and behaviors are not better accounted for by another medical condition, for example, Prader-Willi syndrome, or mental disorder, for example, a depressive disorder, and are not due to the effects of a substance or medication on the central nervous system, including withdrawal effects. There is marked distress or significant impairment. Additional clinical features of binge eating disorder. Binge eating episodes may be objective, or subjective. In either case, the core feature of a binge eating episode is the experience of loss of control over eating. Additional characteristics of binge eating episodes may include eating much more rapidly than usual, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, or eating alone because of embarrassment. With associated negative emotions such as guilt, disgust, or shame, which also typically negatively affect the individual's self-evaluation. When there are multiple binge eating episodes per week and these are associated with significant distress, it may be appropriate to assign the diagnosis after a shorter period, for example, 1 month. Binge eating disorder is often associated with weight gain over time, and obesity. However, individuals with binge eating disorder may be of normal weight or even low weight, though not sufficiently to meet the diagnostic requirements for anorexia nervosa. The diagnosis of binge eating disorder is based on the presence of regular binge eating that is not accompanied by regular inappropriate compensatory behaviors, regardless of overweight status. Preoccupation with one's body weight or shape, frequent checking or avoidance of checking body weight or size, and strong influence of body weight or shape on self-evaluation are commonly present, though not required for a diagnosis of binge eating disorder. Boundary with normality. Infrequent overeating or feasting during culturally sanctioned holidays or celebrations should not be characterized as binge eating disorder. Mindless eating that can be resisted or stopped, for example, if there is a distraction or interruption, or eating more than originally intended without a sense of loss of control, even if this kind of eating is distressing. Course features. Onset, typically during adolescence or young adulthood, but can also begin in later adulthood. The experience of loss of control over eating or sporadic episodes of binge eating may occur prior to the onset of binge eating disorder. Binge eating disorder is more common among individuals seeking weight loss treatment. Binge eating disorder occurs more often among overweight and obese individuals than those with normal body mass indices. Binge eating disorder, although often persistent, has a higher rate of remission than other feeding or eating disorders, with remission sometimes occurring spontaneously or as a result of treatment. The features of binge eating disorder may evolve over time, such that another feeding or eating disorder may better characterize the current symptoms. Developmental presentations. In children, as in adults, binge eating disorder is associated with weight gain, increased body fat, concealing one's eating, and use of binge eating to regulate emotions. Binge eating disorder is more difficult to diagnose in childhood due to normative difficulty engaging in introspection in order to articulate reasons for binge eating behavior. Children are likely to report feeling out of control while eating rather than indicating that the amount of food consumed was excessive. Children with binge eating disorder may experience less frequent and briefer binges as compared to adults because they typically cannot gain access to food without the assistance of adults. Binge eating disorder is common among adolescents and young adults. Culture-related features. The prevalence of binge eating disorder is at least as high in low and middle-income countries as across high-income countries and tends to correlate with rise of body mass index in the general population. The relationship between ideal body size, body satisfaction, and binge eating disorder is complex. For example, women who report strong identification with African American or Black Caribbean culture also tend to report larger body ideals and higher body satisfaction, yet tend to have elevated rates of binge eating. Sex and/or gender-related features. Binge eating disorder is more common in females. There are no significant gender-related differences in the symptoms or course of binge eating disorder. Differential diagnosis. Boundary with bulimia nervosa. If an individual regularly engages in inappropriate compensatory behaviors following episodes of binge eating, for example, self-induced vomiting, use of laxatives, enemas, diuretics, fasting, strenuous exercise or omitting insulin, the diagnosis of bulimia nervosa rather than binge eating disorder should be assigned. Boundary with obesity. Obesity is a common consequence of binge eating disorder and should be recorded separately. However, obese individuals who report overeating patterns that do not meet the definition of binge eating should not be diagnosed with binge eating disorder. Thanks for watching. Please like and subscribe.